Malocclusions, one of the most common types of pathology in the horse. So there are 4 types of malocclusions in the horse, just like there is 4 types of malocclusions in people. And we're going to very briefly go through this because, as I said at the beginning, a lot of this is just show and tell. So we can see here on the left, this photograph is of a horse that has a overgrowth of the 206, the number 206 tooth, which is the upper left hand side first cheek tooth. It's actually the second premolar, but it's the first cheek tooth, and we will commonly call that a rostral hook. And then over here on the right hand side we have what we'll commonly call a caudal hook, which is an overgrowth of tooth 311. These are more common in parrot-mouthed horses. We have a crowding type of malocclusion. So these teeth have mal-erupted. So instead of being in a nice straight line, they are in front and behind each other, which in itself is not necessarily a big deal, but it is a big deal if it causes food to become trapped between the teeth, and that causes periodontal disease. We'll talk about periodontal disease a little bit later. It is the most common disease of the horse, hands down. So if any disease that you can think of, any disease in the whole wide world of horse, actually of mammals, including humans, periodontal disease is the most common disease of horses, humans, and all mammals. And it's super important and painful. So up here on the top left, we can see another type of malocclusion, which is where we have a section of tooth that's grown quite tall, and that creates a bit of a wedge effect going down to drive the teeth apart on the opposite arcade each time the horse chews, and that spreads those teeth apart and allows grass and food to be packed down there, and that food will then rot and it'll eat away at the gum and be very, very painful. On the bottom left, we have a wave mouth. So this is in quite an old horse. This horse, actually interesting, also has a tumour here as well. But for this purpose, for this slide, I just wanted to show you the wave mouth. In older horses, we don't tend to be very aggressive to correct those, because in older horses they have less reserve crown available for them to erupt into the mouth. So the tooth doesn't erupt into the mouth entirely over the horse's lifetime. By the age of about 17 or so, it tends to slow down and then gradually stop as the tooth gets to the end of its life. Over here on the right hand side, we can see another, this is a more severe wave mouth, and what we'll commonly see is when people are looking and feeling in this horse's mouth, they go, wow, look at this great big spike, this big tooth here, it's really obvious. What we're actually more interested in is we're more interested in this divot here, and you can actually see the bone that dips down here. So this spike causes, when the horse chews, it actually goes down between these two cheek teeth, spreads them apart and packs food down there. That food will then rot, and the enzymes in it will lyse or eat the bone and surrounding tissue. So this horse has actually had a lot of bone loss, and this is very inflamed and very, very painful. Oh, another picture there up the top. So that's just showing how the cheek teeth oppose each other.